The birth of a baby is one of life's most wondrous moments to all parents. But have you ever thought of what is happening once the baby is delivered? What will happen in the first few moments? How the baby will react? And what are the essential things need to be done to the baby? So, in this episode, we are going to share some newborn inputs to mommy and daddy out there.
Hi everyone, congratulations on having a new baby. I am Dr. Tan. I'm the pediatrician here in Columbia Asia Hospital, Klang, and we are here at the delivery room. So today I'm going to explain to you all what happens when a baby is born and what does a pediatrician do once the baby has been delivered. So let's go in. So this is our labor room. So most of my action will be here over this side. So this is called an open warmer. Once the baby is delivered from the mother, the baby will be passed to me inside a blanket, something like this. And then I will put him on the warmer. And I will start this timer here. Because in newborn baby, every second counts. So the first 30 seconds, the main thing that we want to do is to make sure that the baby cries. Most of the time, most babies, once they are delivered, they will cry automatically. But there are some babies that will need some support and help. So what we do is basically to put him on the open warmer. I will dry the baby. And at the same time, if he is not crying, I will do some gentle back massage to stimulate him. Or sometimes I might also do a little bit of tapping on the sole. So all this happens within the first 30 seconds. After that, if once the baby is crying, I will do the first check for the baby. The first check will include looking at the activity of the baby to make sure the baby is active, that she is crying, and then listen for the heart rate, and also connect to the SpO2 machine for continuous monitoring of the heart rate and the oxygenation. And for 90% of the cases, that's it. The baby is well. We will wrap the baby up and pass to the mother for skin to skin and also initiating breastfeeding. So one of the things that we do during this period of time that we are resuscitating the baby is also to do an Afghan Scoring. To assess the response of the baby, we will do it at the 1st minute, the 5th minute and the 10th minute. Afghan is actually a person's name, but we use it as a mnemonic also. A means activity, whether the child is active or not. P means pulse. We basically assess the baby whether the pulse rate is more than 100 or less than 100. G is grimace. It's the reflex of the baby, whether he can sneeze, can cough, or he's just a little bit of movement all over the extremities. And the other A would be appearance, whether the baby is pale, is blue, or is pink. And R is respiration, whether the baby is breathing well or is having difficulty in breathing. So the Afghan score helps us to decide whether the baby needs further intervention or whether the baby is safe and healthy for mother to take care. A lower score will definitely means that the child requires more care, and the higher score, the maximum score is 10, would mean that the baby pretty much was delivered normal and then no other issues. Usually the obstetrician will discuss with us regarding the whole pregnancy period, whether there's any risk factors that can adversely affect on the baby when he is born. So if there is, then we consider this as a high-risk delivery and we will definitely be there to stand by. But even if the whole pregnancy period is normal and then no expected difficulty in delivering a baby, there is always unexpected conditions arising during the delivery. I personally believe that all delivery should be standby by a pediatrician.